Again, may we request everyone to please take your seat. We will start in 1 minute. Thank you. Okay. Again, may we request everyone to please settle down. We will start any moment now. So good afternoon to our speakers and distinguished guests from the government, civil society organizations, medical societies, the academe, the private sector, international partners, and other stakeholders from the health sector. I am Joyce Ilas. I am the Assistant Director for Advocacy and Communications for Bauer Group Asia Philippines, and I will also be your host for today. Welcome to this roundtable discussion with the theme Addressing the Gaps to Cervical Cancer Elimination in the Philippines. So this event is organized by the Asia Pacific Women's Cancer Coalition in partnership with JAPAIGO, Cancer Coalition Philippines, namely Cancer Coalition Philippines, namely Cancer Warrior Foundation, I Can Serve Foundation, Carewell Community Foundation, Hospice Philippines, UHC Watch, Project Brave Kids, Pain Society of the Philippines, and Philippine Cancer Society. Several efforts from the government and different stakeholders have been made to reduce and eventually eliminate cervical cancer, a major public health concern for women in our country. However, due to the pandemic and several challenges in the health sector, there is a need for the country to revitalize and strengthen the implementation of evidence-based and cost-effective interventions. Now, this event is a crucial platform for us to discuss how the Philippines can prevent, control, and eliminate cervical cancer through effective planning and sustainable financing. So to open our forum today, we were supposed to have Health Secretary Teodoro Herbosa, but unfortunately, he was informed just this morning that he needs to attend an urgent and last-minute meeting with the Secretary of the Department of Budget and Management. So that's unfortunate, but also very fortunately, he assigned another very important official to join us this afternoon. So to deliver the opening remarks, let us all welcome the lead for Public Health Services Cluster at the Department of Health, Undersecretary Glenn Matthew Bagao. Let's give him a round of applause.
Thank you, our Master of Ceremonies, Joy. To our beloved Senator, I think he's here, Senator Joseph J.B. Ejercito, Senator of the Republic of the Philippines, Dr. Ingrid Bagnata, Country Program Manager of GPECO Philippines, Professor Deborah Bateson, Professor of Practice and Co-Lead of the Cervical Cancer and HPV Stream in the Fodil Center, Ms. Carmen Auste, the Chief Executive Officer, Cancer Warriors Foundation Philippines, Senior Vice President, Cancer Coalition Philippines, Undersecretary of the Department of Budget and Management, Undersecretary Wilfred Wong. Of course, we also have with us the Senior Vice President of the PhilHealth, Renette Limsiako. A pleasant day to all of us. I apologize for Secretary Herbosa because he's attending an equally important matter at the House of the Representatives this afternoon. In fact, he has been there this morning. So he directed me to represent him and deliver his welcome remarks. On behalf of the Department of Health, we thank each and everyone present here today at the multi-stakeholder dialogue on addressing the gaps of cervical cancer elimination in the Philippines. Your unwavering support and dedication to this noble cause is inspiring. Today, I stand before you with a sense of purpose and optimism, as the topic at hand represents not just a healthcare concern, but a rallying call for collective fight against cervical cancer, a commitment to the health and well-being of our women, and a stride towards a future free from the burdens of cervical cancer. In the Philippines, cervical cancer remains the third leading cause of cancer deaths in Filipino women. with about 4,300 deaths in 2022. With an estimated 37.8 million Filipino women at risk of dying from cervical cancer, an estimate of 11 Filipinas dying per day. This report comes from the 2022 WHO Global Cancer Observatory, where cervical cancer was estimated to have caused about 342,000 deaths globally, highlighting the urgent need for a comprehensive national strategy. The battle against cervical cancer cannot be won in isolation. We must adopt a multi-stakeholder approach involving government bodies, healthcare professionals, civil society, academia, and the private sector. By uniting our efforts, we can create a powerful force capable of overcoming the barriers that impede progress. The cervical cancer elimination strategy revolves around the ambitious 90-70-90 goals, which is 90% of girls aged 9 to 15 years will be vaccinated against the human papillovirus by 2030. 70% of women will be screened for cervical cancer. 70% of women will be screened for cervical cancer through a high-quality screening programs by 2030. And 90% of women diagnosed with cervical cancer will be provided with timely and appropriate collaboration with the Pero Philippines, which uses HPV DNA-based testing, a high-quality performance method as a primary screening test for cervical cancer elimination. The project also addresses the continuum of care for cervical cancer to include early treatment of precancerous lesions. It is implemented in 30 project sites nationwide. And to achieve the third goal, we must work relentlessly to improve diagnosis, treatment, and care for women diagnosed with cervical cancer. This involves strengthening the capacity of healthcare facilities, providing specialized training to medical personnel, and promoting early detection. By establishing a robust referral system and reducing financial barriers, we can ensure that 90% of women with cervical cancer receive timely and appropriate treatment and support. Today's panel discussion will focus on two critical areas: National Elimination Plan for Cervical Cancer. We will delve into the strategies and actions needed to achieve our 90-70-90 goals. This includes policy formulation, resource allocation, and community engagement. Improving financial strategies for cervical cancer programs. Sustainable financing is essential for the success of our national strategy. We will explore innovative funding mechanisms, partnerships with the private sector, and efficient use of resources to ensure that our programs are adequately supported. Let us remember that the elimination of cervical cancer is not merely a medical goal. It is a testament to our commitment to the well-being of our fellow Filipinas and the generations to come. Kaya magkapit kamay tayo at sama-samang magsumikap tungo sa isang bagong Pilipinas kung saan ang bawat Pilipino ay makakatamasa ng abot kamay at mas mabilis na serbisyong pangkalusugan. With that, maraming salamat po, and together, let us all work together towards achieving a healthy and cancer-free bagong Pilipinas. Maraming salamat, thank you very much, and good afternoon.
Thank you very much, Yusek Bagao, for that very insightful and inspiring speech. It's such a good way to start the conversation this afternoon. Okay, so before we proceed to our next speaker, we would like to recognize some very important people who are here with us today. We have the ex-officio members of the National Integrated Cancer Control Act Council. We have here with us today Dr. Corazon Yalangel. Thank you. She's there at the back. Thank you for joining us, Doc. All right. We also have with us today Dr. Samuel Ang. All right, and we also have with us today Dr. May Dolendo. All right. Okay. So for our next speaker to deliver the keynote address for today, we are very privileged to have with us today Senator Joseph Victor J.V. Ejercito. He was hailed among the 10 outstanding young men in the field of public administration. Senator JV was elected as mayor for 3 consecutive terms from 2001 to 2010 and congressman from 2010 to 2013 of San Juan City. He was elected as senator of the Republic of the Philippines in 2013 and again in 2022. As chairman of the Senate Health Committee last 17th Congress, he became the principal sponsor and author of the Universal Healthcare Law that was passed in 2019, which aims to provide better access to the country's public healthcare system to more Filipinos. He was also the principal sponsor and author of the National Integrated Cancer Control Law. Now, currently, this 19th Congress, he is the vice chairperson for the Senate Committee on Health and Demography and is also currently a Senate Deputy Majority Leader. So, ladies and gentlemen, let us all give a warm welcome to Senator J.V. Ejercito.
Pleasant good afternoon, everybody. Anyway, first of all, I'd like to thank everyone, the organizers, for having me today. Of course, I'd like to first acknowledge UHC Sec Glenn Agao, PhilHealth Senior Vice President Renato Limuxiaco Jr., DBM Undersecretary Wilford Wong, and Professor Dindo Manhit, and to all those present this afternoon. Again, my greetings. Anyway, I was supposed to be in Baguio today for a hearing on RBA 6 and constitutional amendments, and I just came from Pag-asa Island yesterday. I told Lloyd that I might not be able to go, but for some reason, but if it's about health, of course, which is one of my advocacies in the Senate, being the principal sponsor and author of the Universal Healthcare Act, of course, I will always make myself available. But just to make it clear, there might be some confusion because, as you all know, in the Senate, there are family members, there are siblings, but I think you can see for yourself, I'm the better one in all aspects. Diba na, Joyce? Kaya nga pag may picture taking doon, talagang ang daming pogi, di ba? Magnad si Robin Padilla, si Bong Revilla, hindi ako dumidikit doon. Yung kapatid ko, kahit hindi ko kinakausap, doon ako dumidikit. Kasi lamang tayo. Anyway, we are already on our final session. We are about to adjourn CND. So we are rushing things already. Priority measures, ito na po yung last hura because as when we come back in July, it will be budget season already. So one of the things that I'm pushing right now, which I just defended the other day, is the amendments to the Universal Healthcare Act. No, we have to, of course, you only know the flaws and other things, adjustments when it is already implemented. And I'm very happy also to note, to inform you that aside from the Universal Healthcare Act, which I was able to pass during my first term, the National Integrated Cancer Control Act, one of the landmark health measures, was also passed during my incumbency as chairman of the Committee on Health. But these measures are in its infancy, that's why I really wanted to come back in the Senate. I did not make it in 2019, just as the UHC and the NICA was about to be implemented 2020. Sad to say, I was not there anymore, to foresee and to monitor the implementation. But probably in 2022, although my chances of winning was really very slim, as you know, I just ran 2019 on funds. I did not belong to any major political party. I was running as an independent, and my brother also was running, so may kahati po ako, but probably it's short of a miracle, and probably there's really a mission for me to be able to come back to the Senate, hopefully to be able to see to it that these laws that have been passed and were sponsored by yours truly will be implemented properly. So I'm hoping also that those who were with us, sabi ko nga, nung napasa ko Universal Healthcare Act, that it's a landmark legislation, probably one of the best pieces of legislation that has been passed in the recent years. I'm not a doctor, I'm not a public health expert, but it was doctors and the specialists and the public health experts who really helped me pass this landmark legislation. So I'm hoping that most of them will still be there as we continue to implement these programs. So ladies and gentlemen, esteemed colleagues and dedicated partners in the fight against cancer, good afternoon. It is a privilege to be here today at this important roundtable discussion on addressing the gaps to cervical cancer elimination in the Philippines. I extend my heartfelt gratitude to the APAC Women's Cancer Coalition Philippines, and JPEG for organizing this critical forum. Cervical cancer remains a significant public health challenge in the Philippines. It's the second most common cancer among Filipino women, with thousands of new cases diagnosed each year. We gathered here to share information on the gaps that need to be filled if we are to eliminate cervical cancer in the Philippines. I believe that this ambitious yet achievable goal requires open communication and collaboration effort from the whole of society. I often wonder why is it that despite the availability of vaccination against human or HPV, papillomavirus, many women continue to suffer and die from this preventable disease. This is a stark reminder that there is much work to be done. On my part, we have been working hard to laws that will improve our healthcare system. In the previous Congress, as I mentioned, I authored and sponsored the Universal Healthcare Act and the National Integrated Cancer Control Act. The UHC Act was designed to ensure that every Filipino has the access to quality health services without suffering the financial hardships. NICA, on the other hand, provides a comprehensive framework to address cancer prevention, detection, treatment, and care. Also, every year, as most of us know, we also fight for the funding of these laws. The benefits of the UHC law are now being felt, although it's still a work in progress. No, it's a 10-year program. We're only in the 4th year of its implementation. The support value of PhilHealth is 66%. No, before we passed the UHC, the out-of-pocket expense, meaning it's about almost 70%. Coming from every pocket of every Filipino. But now, when we were able to pass the UHC, it's almost down to about 40 to 45%. We are also working on amendments to the UHC Act, which will revise the PhilHealth premium rates. We adjusted these rates in due consideration of changed circumstances, because when we were drafting the UHC law sometime 2018, 2019, nobody foresaw the pandemic coming. Nobody predicted the pandemic to come. As such, of course, we have to adapt to the situation. That's why there was a need to amend the law so that it will not add burden, no? As we are still in the stage of recovery. These are my contributions, my commitment to our cause. Together, we have the power to make cervical cancer a thing of the past. Let us bridge the gaps and create a future where no Filipino one has to suffer or die from cervical cancer. And likewise, before I end, another good news with regards to healthcare, the Senate likewise added bigger budget the past 2 years for the establishment of specialty centers around the country. Right now, as we speak, in Southern Philippines Medical Center, for example, in Davao, and the Northern Mindanao Medical Center, Cagayan de Oro, and Visayas, the Western Visayas Medical Center, Bisoto, there are already, the specialty centers are partially working already, operating. In fact, they are already able to perform open heart surgery and hopefully kidney transplants very soon. Dati po, nagsisiksikan po dito sa Metro Manila, no, sa Philippine Heart Center, sa National Kidney Technical Institute, and Lung Center. But now, with added funding from 2 billion, we increased in the Senate to about 4 billion. Now it's about 10 billion. So having the goal of having specialty center, establishment of these specialty centers will soon become a reality. Kasama na rin po siguro yung cancer centers, no? Hopefully, diba, Yusek, we have already funded the NICA recently. No? Medyo na delay because of the pandemic, but hopefully this time around, the full implementation will now be possible. These are my contributions, my commitment to our cause. Together, we have the power to make cervical cancer, as I mentioned, a thing of the past. So, pagtulong-tulungan po natin. With that said, I look forward to our productive discussions and the concrete actions that will emerge from these roundtable discussions. So again, thank you very much for having me this afternoon, and I look forward to a very productive discussion, and that will help us, of course, in our job, in our quest to have a genuine healthcare, of course, with the cancer care in mind. So again, magandang hapon po sila. Good afternoon. Thank you very much.
Thank you very much, Senator J.V. Ejercito. And thank you for all that you do for the cancer patients here in the Philippines. Again, let's give him another round of applause. All right. So as Yusek Bagao mentioned earlier in his speech, an important part of the World Health Organization's 90-70-90 global strategy to accelerate the elimination of cervical cancer by 2030 is the screening of 70% of women with a high performance test by 35 years old and again by 45 years old. So our first speaker for today, Dr. Ingrid Magnata, the Country Program Manager of Japaigo Philippines, will discuss Japaigo's centralized laboratory model for HPV screening, or CLAMS project. CLAMS aims to increase testing capacity of public facilities through a centralized laboratory model to test HPV samples in alignment with the global strategy for cervical cancer elimination. Ladies and gentlemen, let us all welcome Dr. Ingrid Magnata.
Thank you. Magandang hapon. Good afternoon, everyone. This is indeed an opportunity for us to share what Japaigo is doing in partnership with the Department of Health, World Health Organization, and the several stakeholders that are present in this room. So this is the presentation. We are Japaigo. We are a non-profit international NGO. We are a Johns Hopkins University affiliate. We've been in the country for more than 3 decades, supporting the Department of Health as well as the local government unit. So in particular, we're going to share with you one of the projects or one of the portfolios that we have in the country. This is accelerating cervical cancer elimination through secondary prevention strategy. Next slide, please. So we all know that we have this clarion call that is global women's cancer, if not prevention, but for cervical cancer, we are into elimination. So if you will see the presentation here for this slide is not just for cervical cancer, because we also have an advocacy that we want to see breast cancer being integrated in cervical cancer elimination strategies. Next slide, please. So let me just be straightforward on what we are doing because this is not a rocket science as far as cervical cancer elimination, because as WHO mentioned that we have all the modalities present in the world and especially also in the Philippines. So we know that the ambitious goal of 90-70-90 is far from. We have a presentation yesterday that this strategy or this call might be achieved by the Philippines. The elimination level would be sometime in 2064, but the challenge is really have to start now. And the target of 90-70-90, that is in 2030, again, as we are seeing based on our current status, this is a challenge for us, but we are glad that we have started it, and we are thankful with the WHO that they have released the guidelines of the cervical cancer elimination framework as far as the WIPRO or Western Pacific region is concerned. So for the cervical cancer portfolio, the design is we need to establish our governance structure in the country. So we have started the cervical cancer elimination initiatives in the country because we have the NICA law. So we are thankful for that. So we really fought for this project to come in the country because we are saying that with the mandate that was set by the government of the Philippines to really address this concern would be our guide towards achieving this call. And then, of course, awareness and demand generation. That's part and parcel of any public health programs that we need to do. And integrate service delivery models in the existing RH services. And of course, create sustainability and scale-up conditions and incorporate implementation research. Very simple, right? And then the intention is cervical cancer elimination. We can do this. Okay, next slide, please. And for Japaigo cervical cancer portfolio on primary and secondary prevention strategy, these interventions as a development partner, we catalyze and move the country towards cervical cancer elimination by improving HPV vaccination, and cervical cancer screening through increasing coverage as presented yesterday and earlier in the discussion. For HPV vaccination, we are 30%. The target is 90%. And then the screening of 70%, we are in 1%. And we don't have a good data on the number of women treated if those women were found positive based on the screening procedure. But though the challenge is there, but we are working on it. So that's the beauty. So this is why we are all here in this room. And increasing efficiency, of course, increasing efficiency based on the discussions that we have several occasions that we're looking at different modalities and how to improve the cervical cancer screening. So we have VIA, we have pap smear, and because of the technology present, we have now the molecular assay. And molecular assay is that the HPV screening is done through self-collection. And self-collection is a game changer in this country, and not just in the Philippines, but as well as in other countries. And then because of the molecular assay, of course, it's very highly sensitive and specific. And then when we do screening, we're not just doing screening, but rather we're linking that to treatment of it's not just for cervical cancer, but as well as in all other cancer types. Next slide, please. So the portfolio, the projects that we have is we have this was introduced in the country in 2019, and then we implemented this in the midst of the pandemic. And this one is funded by UNITE. This is the
All right, achieving global and national goals towards cervical cancer elimination will require effective planning supported by sustainable financing. Our next speaker, Dr. Deborah Bateson, Professor of Practice and co-lead of the Cervical Cancer and HPV stream at the Daffodil Center in Australia, will discuss how the national strategy for the elimination of cervical cancer in Australia has set the country on track to eliminate cervical cancer by 2035. Let us all give a warm welcome to Dr. Deborah Bateson, who is joining us via Zoom all the way from Australia. Let's give her a round of applause, please. Hold on, Dr. Bateson. We're just having a slightly technical problem. We can't seem to hear your audio. Okay, can we try that again? Can we try that again? Okay. We apologize, Dr. Bateson, but we're still having difficulty. We still can't seem to hear you. Yes. Yes, I think the problem is from our end. We're just trying to address it here.
No one can hear me. I can hear myself. My microphone is working. I can't see the slides. I'll just wait a second. And the slides will come up soon. That's all right. Thank you. Thank you.
Okay, and we apologize as well to everyone here with us today for this technical problem. It happens. Okay, that sounds nice. Let's try it again, Dr. Bateson, please.
Hello there. Can you hear me now?
There, we can hear you. Thank you very
wonderful.
much.
Thank you. Well, look, thank you to the organisers for inviting me to speak with you today. It's an absolute privilege to be amongst such distinguished guests and speakers. And thank you too to Dr. Magnata for setting the scene so well. And congratulations to you all for forming the Elimination of Cervical Cancer movement. I can't actually see my slides, so if we could bring my slides up, that would be fantastic. Wonderful. Thank you. So it's my absolute pleasure to talk about the impacts of the National Strategy for the Elimination of Cervical Cancer in Australia. And as mentioned, I'm Dr. Deborah Bateson, and I'm at the Daffodil Centre, which is a joint venture between Cancer Council New South Wales and the University of Sydney. And next slide, please. So this is Professor Karen Camphell, who's the director of the Daffodil, and she says, we have the technology to eliminate cervical cancer and the peer-reviewed evidence to show it is feasible. We now need the political will in all countries to make it a reality. Next slide, please. Now, we're all familiar with these 90, 70, 90 targets, so I won't say them again. They are ambitious. I just wanted to highlight that these are two Aboriginal women living in a very remote area of Australia. We're a vast country and some people live in a very isolated place. So next slide, please. So let's have a look at Australia and what's happening in terms of primary and secondary prevention. So we do have a national HPV vaccination program and a national cervical screening program. We also have a national cancer screening register, and this has been absolutely crucial to our move towards elimination. So the Cancer Register, what it does, it's a digital register, so it supports monitoring and evaluation and policy development, but also it sends invitations and reminders and prevents that loss to follow-up. Next slide, please. So this is a busy slide, and I just want to highlight our progress with HPV vaccination. So our vaccine program started really back in 2007. We introduced the quadrivalent Gardasil vaccination, a 3-dose regime, initially for girls, school-age girls aged 12 and 13 through the school program. And then in 2013, we implemented the vaccination for boys as well, again through the school program. The next big change really came in 2018 when there was a shift to the 9-valent vaccine, a 2-dose course. And then the other big change was last year in 2023 when we shifted following WHO recommendations to a single dose, a 1-dose regime, and that's for girls and for boys with the 9-valent vaccine. And we've also now got catch-up for everyone who's eligible up to the age of 26. And we know that some people don't get the vaccine at school, so this is important. Next slide, please. But let's have a look at our screening program. We've actually had an organised national screening program since 1991. And until December of 2017, this has been based on pap smears, on cytology, every 2 years from the age of 18 to 69. And state-based registers sent reminders to people. But then, because of the overwhelming evidence for the superiority, the sensitivity of HPV testing, and the cost-effectiveness of HPV testing, as well as the acceptability by the community, this evidence was all given to the Australian government, who oversaw the what we call the renewal to this new program from the 1st of December in 2017. So there was a switch to primary HPV testing with partial genotyping, and anyone who tested positive for a cancer-causing oncogenic HPV type has cytology triage. It's every 5 years from the age of 25 to 74. And now we've got a national register, and this register not only sends reminders, but also invitations. And then the other big game changer, and it's so great to hear how acceptable that self-collection is here for you in the Philippines. So we implemented universal access to self-collection, so anyone eligible for screening could choose whether to have a self-collection of a vaginal sample or clinician collection with a speculum. And I'll just get you to press the next slide. There's a little infographic going to come up. Thank you. And what we're finding is this is a game changer in terms of equity. It's around about 30% of all our screening tests now are self-collected. It really is bringing in people who are under-screened, and this is what we want. So next slide, please. But of course, implementing all these massive policy changes takes many intersecting jigsaw pieces, if you like. We needed to bring everyone along on this journey. We needed to have the screening algorithm, and it was interesting to see yours just before. So the development of the screening algorithm, and obviously all of the screening program and the upskilling of the providers, of course. So we had to have the training for the GPs, for the nurses, for the gynecologists. I've talked about the National Cancer Screening Register. We had to reconfigure it for self-collection. But I've also put a picture there of the laboratory. This was probably one of the most challenging sectors to bring along. It meant huge workforce changes. So all the cytopathologists, there was a massive change when we moved to that automated HPV DNA testing, the PCR testing, and it really was quite challenging for some labs. Many labs are private in Australia, but we have brought everyone along. And of course, we need to have the consumers at the centre. So, of course, consumer-facing campaigns, and I like this one for people with disability, and consumer-facing resources to support self-collection, for instance. This resource comes in 26 different languages. So lots of different pieces to attend to. So next slide, please. So this brings me to the development of Australia's National Elimination Strategy. It's a national plan, a vision with 10 strategic priorities to eliminate cervical cancer by 2035 and to eliminate it equitably. And in fact, this was launched by the Assistant Minister for Health, Jad Carney, in October of last year. And as you can see here, she's making the pledge to follow this elimination plan And in fact, $48.2 million has been pledged and is going to be spent to implement this plan. So, and the implementation plan, we're awaiting it any moment to come out from the government. And this is, a joyful time for us. So next slide, please. So this is the elimination journey, if you like. I've just talked about the launch of the elimination strategy last year, and we are aiming to reach those 2030 goals, those 90, 70, 90 goals by 2030. Now, by 2035, Australia is on track to be one of the first countries in the world to eliminate cervical cancer. That means reaching that threshold of less than 4 cases per 100,000 women. And of course, we all need to support each other. We want to support all countries to reach this elimination goals, these elimination targets in the next century by 2120. Next slide, please. But what we know in Australia is that cervical cancer inequities exist, and we have to address these. So your chance of getting cervical cancer definitely depends on who you are. We know that if you're an Aboriginal or Torres Strait Islander person, your chance of dying of cervical cancer is just over 3 times more than for other women. It depends on where you live. We know that if you live in a remote area or a regional area, you're twice as likely to be diagnosed with cervical cancer, and it also depends on your socioeconomic status. And what we know is that over 70% of cervical cancer cases occur in people who are underscreened, and all our efforts need to go into bringing in these underscreened people. Next slide, please. So how have we done it? Well, we've set up an expert advisory group for the elimination response. We call this EAGER, and it's chaired by Professor Karen Campbell from the Daffodil Centre. And of course, it has to align with the Australian Cancer Plan. So on this committee, we've also got the CEO of Cancer Australia. We've got representation, of course, from government, from clinical bodies, including gynecology. And then we've got vaccine expertise, of course. And then, all importantly, we've got representation from the community, from Aboriginal and Torres Strait Islander community, from culturally and linguistically diverse communities, from the LGBTIQ community, and also here's my friend Tricia Maloney representing the disability community, a great advocate. And so the role of this committee or this group has been to guide the elimination strategy, the development of those 10 priority areas, and now, of course, it's going to be supporting guidance for the implementation of the plan. So next slide, please. So what have we found in terms of major themes that have emerged through all the consultations? There have been many meetings, and it's come out with the fact that communication is absolutely key, as is education, partnerships and advocacy. But we all, of course, are around improving access for people who aren't accessing either the vaccination programs or the screening programs now. And we need to provide these in ways that are culturally safe and inclusive and led by the community. Workforce development is absolutely crucial, and at the bottom of this, it's because it's underpinning everything, is that absolute requirement for data to support monitoring and evaluation is absolutely crucial. Next slide, please. So we've set some strategic targets, and they differ slightly from those 90, 70, 90 targets that we've talked about from WHO. Our incidence, we're still setting our 2030 target at fewer than 4 new cases per 100,000 women. In terms of vaccination, yes, 90% of eligible people are vaccinated. 70% of eligible people, our screening target, that is still 70%, but instead of being twice in a lifetime, this is every 5 years. And we've been a bit more ambitious around treatment. Treatment is so important of pre-cancers, but also of cancers. Ethically, we need to make sure that we're treating people equitably who do have invasive cancers, and also providing equitable palliative care. And we've set that at 95%. We need to bring along all of these priority populations. Next slide, please. So how are we going? So we actually do have, and this needs to change to 2023 because the data has just come out, and I've actually used the data on this slide because we have annual elimination progress reports where we're reporting our data, where we've got it, against the against those targets. So if you look at the top, if we look at cervical cancer incidence, we're not quite there yet in terms of fewer than 4 cases. We're overall 6.4 per 100,000. So we've got a bit of a way to go, but we've also got equity gaps. I mentioned before about Indigenous women. It's 3 times higher rate of cervical cancer incidence, 2 times higher in remote and very remote areas. We've got to concentrate on closing these gaps. HPV vaccine coverage, not too bad. You can see 85.3% of girls vaccinated in 2022, but we are missing those girls who aren't in school. They miss out on vaccination. We're hoping that through the catch-up program up to the age of 26, through your GP, and that's going to help fill that gap. Screening participation. So 79.6% of women aged 35 to 39 have been screened at least once with an HPV test by the end of 2022. We don't actually have the data yet. We'll have it soon to see what's happened in that second round of screening. We're just starting that second round. If you look to the left, you can see treatment of cervical precancer. We've got good colposcopy data, and we can see that 88.5% of those with cervical precancer detected in 2021 were treated within 12 months. But there's indicator we can't report on is treatment of cervical cancer. We simply don't have national data available. And when it comes to the implementation plan, this is a key gap that we need to fill. We need to make sure that we're providing treatment equitably to all the groups. And when, again, it underpins the importance of that data. We've got a little bit of subnational data. So very important. The next slide, please. Thank you. So now I just wanted to touch briefly on some other Australian government funding. So this is Minister Wong, Penny Wong. She's the foreign minister, and she was announcing what's called the regional through the Partnerships for a Healthy Region grants. And so a project that our team and many partners are involved in is called EPIC. That stands for Elimination Partnership in the Indo-Pacific for Cervical Cancer. This is Dr. Lucas Tatoka on the left-hand side. He's the head of Global Health Security, launching our EPIC program last October. So let me just come to the next slide, and I'll just tell you briefly about EPIC. So EPIC is designed to provide support across all the WHO elimination pillars. It's got a sustainable tiered approach. We've got actually 8 countries in the Indo-Pacific who are in scope for the 5 priority areas of work I'm going to tell you about in a minute. And these tiers it starts off with countries where, because they're small populations, they're ready to actually have support for national elimination. This includes countries like Tuvalu and Nauru, for instance. And then there's countries where they've actually started screen and treat programs, for instance, such as in Papua New Guinea and Malaysia. And this is to increase to other provinces, increase their large populations, of course, and Fiji also falls into this category. And then we've got countries like this is Timor-Leste and Solomon Islands, where there's no screening, no organised screening, but they're going to be demonstration projects. But I wanted to talk about the other tier because this is actually all countries in the Indo-Pacific, and this includes the Philippines, where in fact the EPIC program can, through the daffodil, provides modelling to support policy decisions. And we've got something called the Elimination Planning Tool, which is a very exciting tool in collaboration with WHO and many other partners, where countries can put in their own data into this tool, and it can support the projection for when elimination would occur based on policy decisions. So we've got these 5 priority areas of work. One is to support vaccination rollout, particularly supports overcoming hesitancy. 2 is screen and treat, and we heard about thermal ablation before. So generally this is using a screen and treat approach with offering laboratory or supporting laboratory strengthening, not just for PCR tests, but for histopathology. We know that can be an area that would benefit from strengthening for some countries. CanScreen, so again, the screening register is all important for any program to prevent that loss to follow up and capture the data. And then, of course, we've mentioned to Dr. Magnata as well about the importance of treatment, not just pre-cancer, but also of invasive cancers and palliative care, which can be delivered at the community level. And I mentioned that 6th pillar, which is the modelling support. And the next slide, please. Thank you. So I just wanted to say this is a program where we've had some support through philanthropy, working with the government in Vanuatu, and they're the first country in the Pacific to actually launch their elimination of cervical cancer strategy last October, which was, congratulations to this country. And next slide, please. And I'd just like to say thank you and just to recognise my colleagues, Professor Karen Canfeld, the director of the Daffodil, who's provided much of the support to WHO for these targets, and to Professor Marion Saville, who's led on the elimination strategy. I've put in a link there to our elimination plan, and I'd urge you all to read it. But thank you for your attention.
All right. Thank you very much, Dr. Bateson. That was a very insightful presentation. Okay.
Thank you.
Given the success that other countries have had in the formulation and implementation of a national elimination plan for cervical cancer, just like what Dr. Bateson presented earlier, it is just timely that our first panel discussion will discuss its necessity here in the Philippines. So while the Philippine government has been implementing several health programs aimed at the prevention and control of non-communicable diseases like cancer, the country lacks a national plan to address cervical cancer. So this panel discussion will discuss the need for a comprehensive national action plan with clear targets, timelines, and costs. Additionally, it will advocate for increased collaboration among stakeholders to ensure the success of cervical cancer prevention and control initiatives. So before we proceed to our panel discussion, we will first hear the opening statements of our panelists. Starting with our first panelist, let us all welcome Dr. Jan Lievado, Chief of the Cancer Control Division at the Department of Health.
Hi, good afternoon, everybody. Allow me to catch my breath. We're running simultaneous activities in 2 rooms. So good afternoon. So I didn't prepare an opening statement. I'll just wing it. So for the past year, we have been developing our National Integrated Cancer Control Council strategic framework. So while we recognize the need for us a specific cervical cancer elimination plan, we also wanted to recognize that, in the Department of Health, as well in the local government units and in our hospitals, systems allow us really to integrate services. So I think for this session, one of the things that I would like to highlight is that while we need a plan, we also to think about the systems that we are capable of. So that's one. Second is the plan is very important because we need to cost everything. So probably the interests of this group right now is how many vaccination do we need until 2030 or afterwards, right? Do we vaccinate 6.6 million 9 to 14 years old? What is the Philippine strategy for in terms of HPV prevention? How about the HPV DNA kits? So that is why we need to see it in our plan to actually know and have a roadmap of what we are supposed to achieve until 2028 at the end of the administration and until 2030 and forward. So that's the second one. So while we have this separate plan for cervical cancer elimination, we also wanted to anchor this plan to the National Integrated Cancer Control Council kasi ayaw natin ng siloed plan. And also, we don't want just to plan. We want to implement all of these things. So remember, in the local government units, the midwife, while they implement the human papillomavirus vaccination, they also implement family planning, maternal and child care, ano pa ba, ma'am? Non-communicable disease, right? So hypertension and DM and all of those things. So these are the things also that we wanted to look into. Third is part of the plan should be actually the absorptive capacity of the government. So even if we have a lot of HPV DNA kits, all over the Philippines, if these kits will expire, because no one is accepting and no one is using. So there's a question of kaya ba natin gawin yung mga bagay na yun? Right? So, even if we ask for um, HPV DNA kits to actually target the actual women that needed it. So, maybe we should also think about if we have the absorptive capacity to do all of these things. So I think these are the things that I also wanted you guys to think about when we draft this plan, and to think about how do we anchor this plan to the National Integrated Cancer Control Council strategic framework. So that's it. Good afternoon.
Thank you very much, Dr. Jan. All right. For our next panelist to also deliver an opening statement, I would like to invite back on stage Japaigo Country Program Manager, Dr. Ingrid Magnata. You want to deliver another opening speech, ma'am? Or no? Okay. We'll proceed to our next panelist then. May we call on Mr. Marco Valencia Sanchez, President of the Health Technology Association of the Philippines and Country Manager of Roche Diagnostics.
Thank you. The opening statement part is a bit of a surprise, but I have a couple of words to say to warm up. I was reflecting on the message from Undersecretary Glenn, and one thing he said that struck me is that the battle cannot be won alone, and this made me reflect. Right, made me reflect on the major most critical healthcare issues that we have faced over the last few decades. Take HIV, for example, AIDS treatment and management, or more recently, COVID. How we've been able to be successful really by coming together and really together from very different places, angles, position, facing these threats and if not defeating them, really lessening them and making them manageable when we actually do something. So my reflection was that we really need to be comfortable coming together and joining forces to defeat these enemies, right? Since we're in the battle mode. And I'm thinking that HPV/cervical cancer, I would call it the perfect enemy, because we know how to defeat it. We have the way, we have the information, we have the tools. And it's really about organization and us coming together to do something. And us being here right now is really the right milestone to come to a way forward, right? Every step forward that we take will take us closer. So I'm really looking forward to this discussion with you. Thank you.
Thank you very much, Mr. Marco Valencia. Now for our next panelist, let us all welcome Dr. Karen C., Cancer Program Manager of the Quezon City Health Department.
To all the distinguished guests, stakeholders, colleagues, and participants, good afternoon. Cervical cancer ranks second in cancers among women in the Philippines and sixth in Quezon City. Early detection and treatment are among the factors that may contribute to the high survival rate, but most patients have hesitations to undergo screening, checkups, and worry about the huge expense. Quezon City Cancer Control Programs challenges includes patient navigation and referral pathway. No trainings for additional manpower because we have a low budget. Quezon City also identified gaps in cervical cancer elimination, such as low demand generation, especially in cervical cancer prevention using HPV vaccination, treatment accessibility, screening, and loss to follow-up clients. Quezon City is lucky to be part of the success and CLAMS project of JPIGO. Through these projects, Quezon City was able to use HPV DNA tests aside from VIA among eligible women for cervical cancer screening. 16 doctors and nurses were also trained on thermal ablation. As of April 2024, Quezon City accomplishments on cervical cancer screening are as follows. VIA, we already screened 5,059 with positive was 64. HPV DNA screen 1,552, and 115 of them turned out to be positive. So about 13% became positive. So interventions such as thermal ablations were done in 16 patients. Cryotherapy in 2 patients, 2 were referred for biopsy, and 2 were confirmed with cervical cancer. So some are still for follow-up, and others were evaluated and referred to hospital of choice. So way forward for the Quezon City Cancer Control Program is the creation of health promotion materials for cancer prevention and control. We need to educate the people in the community. Integration of HPV vaccination and other programs like family planning in Quezon City Cancer Control Program. Recently, the Quezon City Integrated Cancer Control Ordinance was passed on third reading last May 13, which means we will be having a budget for next year. And then with the passing of the ordinance, we will be crafting our own annual operation plan for 2025. And we look forward to more partnerships with other stakeholders and meeting with partner hospitals for referral pathway for our QC patients screened for cervical cancer. And most of all, we will do the cervical and breast screening in the community and workplace because we need to screen 51,000 until the end of December. So thank you very much and good afternoon.
Thank you very much, Dr. Karen C. And may we call on again for her opening statements for this panel, Dr. Deborah Bateson.
Oh, thank you. Look, I'll just say a few words really, because you've heard me speak already, but perhaps just some of the lessons learned and just congratulations on this journey to setting up this implementation plan. So we have certainly learned that, you know, this multi-sector consultation, collaboration, partnerships and communication is absolutely key. And having communication that is the same as well. Just ensuring that the messaging is always, you know, on target, and you know, not leaving anyone out. That includes your professional colleges, your civil society, and I'll mention again the laboratory sector, and particularly I know we've got Roche here, because it was perhaps the most challenging sector for us. We know that, you know, there's many private labs, and to bring everyone along, there's many unvalidated HPV tests around. And we needed to make sure that only validated tests were used and that there was standardized quality assurance and recommendations given out. And that's been successful. But again, I think we perhaps would have done things a little bit differently had we known. I think, again, it's just crucial that the voices of the community are absolutely central in terms of co-design of health promotion messaging and health literacy. And this is the only way that you're going to get, you know, innovative new models of care, for instance, to work if you're bringing the community, getting community leadership and community buy-in. So I think that's one thing we've learned. Development, workforce development and training, and using your workforce to their full scope of practice. What we know is that we've got very few doctors often in remote areas, but we've got a lot of nurses. But we've actually got barriers to nurses ordering pathology, for instance. They can't get, their patients can't get a reimbursement. So there's some systems issues that we've got to overcome with our implementation. So just we'd be using Aboriginal health workers, disability support workers, and particularly now we've got self-collection, they can help support that. And just last but not least is just that stress around that collecting that good quality data. We're just about to embark. So a screening registry or vaccine registry, you want it to be able to link to other data sets. So at the moment, there's no way I can tell what the proportion of people with disability, for instance, in Australia is who've had screening, because it's not linked to the census, for instance. But that's all going to change, and we're going to have linked data, so we'll be able to look at those priority populations. So I just want to say, you know, thank you, and it's a delight to be part of this conversation. Thank you.
All right. Thank you very much, Professor Deborah Bateson. Okay, so at this point, we will now proceed to our panel discussion. So may we invite back on stage our panelists, please. Dr. Jan Llevado, Dr. Ingrid Magnata, Mr. Marco Valencia, Dr. Karen C., and Professor Bateson will still be joining us via Zoom. And to moderate our discussion, may we call on Dr. Concepcion Rayel, a trustee of the Philippines Obstetrical and Gynecological Society, or POGS, and chairperson of POGS Unified Action Against Cervical Cancer. Let's give our panel a round of applause, please.
Good afternoon, everyone. Again, I'm Concepcion Damas Orayel, representing the Philippine Obstetrical and Gynecological Society. Okay, thank you. I will be moderating this panel, this first panel discussion. And the first panel will emphasize the need for the national elimination plan for cervical cancer in the country. We know that the action plan, to be successful, has to include targets, timelines, and collaboration. By collaboration, we mean political support, cooperation of multisectoral partners, universal health coverage, resource mobilization, health system strengthening, and health education. So for the first question, I would like to direct to Dr. Jan Llevado, our representative from government and the DOH Cancer Control Division Chief. Dr. Llevado, a dedicated national cervical cancer elimination plan is a clear need. It is a definite need today. So the question is, how does this complement the Department of Health existing cancer programs and initiatives? Also, is this aligned with your strategic framework for cancer?
So, thank you. So actually, we developed the National Integrated Cancer Control Council strategic framework. So the ownership really of the framework is the council. Basically, it's the council's roadmap until the end of the administration until 2028. So we have 5 strategic focus there, and one of which is really about cancer prevention and early screening and early detection, where cervical cancer, part of the cervical elimination is, is inside those strategic focus. So actually, our initial plan with Dr. Ingrid Magnata with Jipago Philippines is really to create a separate plan for cervical cancer elimination. So we have that plan. However, in the operations plan, we actually integrated the other plans of the secretary, because we also have to, to consider the administration's plan. And while we push forward for a separate plan for cervical cancer elimination, we also wanted integrated services. So, ano siya, ma'am? I think it's chicken and egg. Yeah, one of the thrusts. So in our current operations plan that we're working on, where we just recently finished our first workshop, basically the operations plan are the list of initiatives and activities that we will be doing annually until 2028. There will be a special plan for cervical cancer elimination. So Dr. Ingrid is helping us with that, along with the costing of of all the initiatives and activities for cervical cancer. What we need to do right now, basically for the Department of Health, is really to decide on strategies. So for example, for the human papillomavirus vaccination,
action plan?
Yeah, actually, it's integrated in the discussion already of when we discuss making the HPV DNA screening accessible and available in the country. So the design of the centralized laboratory model is to set up the diagnostic procedure in an urban area or in a highly populated areas wherein you have set up a referral mechanism or a system wherein the primary healthcare facilities are doing the collection of the cervical sample, and then these cervical samples are transported in a high throughput diagnostic procedure wherein there would be a high, I would say, shorter turnaround time for the patient to be notified of the result because of the high volume capacity of that diagnostic procedure. So that would be very much relevant as we ramp up the intention of reaching more women. So this can be for us, no, for Japarga, we're looking at if we have all model, but you have to have a good network of the referral system from transport, from the discussions with the primary healthcare level. But of course, we're looking at the other modalities as well that can be beneficial for
It's policy shaping, yes. It's the development of a national plan, yes. It's the piloting, and it's the scale up and the sustainability of the program. What I heard now, also what I heard is the fight is really at the community level, right? All of these things is something that the private sector, in this case, my company Roche, has been involved in for years and years on end in multiple geographies, whether it's Australia, Thailand, and now very recently with Indonesia, where we're working with APEC and the Ministry of Health. Was mentioned how critical it is that we educate, right, and we teach, and it's not just the community, it's the doctors as well, right, and it's really systems in general, right, that we need to educate. It's not single people, and we need to connect all the dots within the system, and this is something that a company like Roche can support, because we have contributed to it in the past in multiple sets of partnerships. Then there is another point that I want to make, right? And again, it's a bit of a step out of this. Right now, we're talking about cervical cancer elimination, but we have multiple problems in our geographies, and it is important that we solve multiple things as much as we can at the same time. So we leverage the same platform over and over, right? So, for example, if we're talking, and the point I'm trying to make is related to your point, if we're talking about eliminating cervical cancer, then we can use similar learnings and platforms to tackle tuberculosis, to tackle HIV. So some of the support that we can offer is a multi-disease testing platform, in which it is not just about HPV. It is right now about cervical cancer elimination. But if we want to scale up at a national level elimination programs, and we want to make them sustainable, right, and cost effective, we need to leverage this and tackle other diseases as much as possible within the same system. And the final point I want to make is, we cannot underestimate what it will take to scale this up to a national level. We have seen it in many countries, and right now we're doing the right thing. We're piloting this, we're learning. But moving from 5,000 to 50,000 will be one challenge. Now, moving from 50,000 to 1 million will be a very different challenge. And then to 30, 40 million, which is what the Philippines will need, will be a very different challenge. So all this is something that the private-public partnerships together can tackle, right? And it goes from national government to LGUs. And we recently actually signed a memorandum of agreement with Quezon City here to tackle at the local level, at the city level, this through a multi-disease testing platform. So all this really comes together in this effort.
Okay, thank you very much, Mr. Sanchez. And now I'd like to ask Dr. Karen C. a question. So, what are the challenges in Quezon City, particularly in providing timely and accurate cervical cancer diagnostics to residents? What were the challenges you faced?
Challenges were faced were referral. We don't have a referral pathway before. Referral pathway and patient navigation. So it's very hard to screen. We're just doing the screening, and then after the screening, we don't know where to send the patient. Yes. So right now with the NICA law, the ordinance that we have right now in Quezon City is doing a referral pathway, and hopefully we will do the digitalization of the referral pathway and patient navigation. As of now, we have trained 66 community health workers to be our patient navigators in the community.
Okay, thank you. Okay, thank you, Doctor. Maybe we can now ask questions from Dr. Bateson.
Thank you.
Professor, the first question is, what lessons and best practices can the Philippines learn from other countries in developing and implementing a national action plan to eliminate cervical cancer?
Thank you for the question. I hope that I've covered some of this in my presentation, but I think one of the key things is doing exactly what's happening here, which is bringing people together. I think the biggest risk is fragmentation and not bringing people all together. So I think that's communication, having a centralized communication strategy is absolutely essential. And I think the other thing is really just ensuring that you are involving civil society and the community, because you can develop all sorts of different approaches, but if the community hasn't been involved, then there's a big chance that they're not going to succeed. But I think it is about it's having that collaborative approach, setting those timelines, being realistic. I mean, it's obviously Australia is a rich country. We've got a population of 25 million, much smaller than your population. And we've had an organised screening program since 1991. So, and so we've had to be able to think about, all this time, how to think about this elimination strategy. So I just congratulate you all for really, first of all, just putting yourselves together. But thank you for inviting me as well. We're very, very happy to share any learnings that we've got, that we've had. But I think it's around just keeping that communication channels open, and making sure that that's really what I want to say to that.
Professor, your results are also very impressive. You have a vaccination rate of 85% and the screening rate of almost 80%. That's 79%. So congratulations. But this is the last question, Doctor. What opportunities for cross-border collaboration can the Philippines pursue to accelerate progress in global elimination goals?
Yes, so thank you for this. This question is for me, is that right?
Yes, Doctor.
Yes. So as I mentioned in the presentation, the Daffodil Centre and our collaboration has got expertise, and we're very willing to work with the ministries of health, with governments in the region, in the Pacific region, with our modelling work to support that policy making decision. So I mentioned before, I think Dr. Joe, with you, just around the number, how many vaccines do you order? What's the decision you make around vaccination? You're going to vaccinate boys as well as girls. You're going to go in one dose. So our program can help support those decisions with our modelling approach and modelling work. And we're also happy to share our experiences. I've been talking about the experience in Australia, but we also have a lot of experience about working with our partners in, for instance, Vanuatu, where it is a screen and treat approach using the gene point of care testing and thermal ablation, and a lot of experience in training around these areas. So we'll be delighted to be able to support efforts in the Philippines. I think there's just a lot of work going on. Yes, please do reach out to us. Again, I can't stress enough, I suppose, the importance of the registries. I think it's just a really crucial component that sometimes can be left behind. And without that registry component, it can help with the roster follow-up that we've been talking about, but it will also just help for that sustainability of the program. And so it's an early investment that is worth doing, but we're very open to collaboration with the government.
Thank you very much, Professor. And I also would like to thank all our panelists because I think it's a panic mode. Thank you.
Again, thank you very much to our moderator, Dr. Rayel, and to our panelists, Dr. Llevado, Dr. Magnata, Mr. Sanchez, Dr. C, and Dr. Bates. And again, let's all give them a round of applause for that very insightful discussion. All right. Thank you. So to effectively implement a national plan, the Philippines will need to explore sustainable financing mechanisms for cervical cancer elimination. High out-of-pocket expenses and financial constraints prevent Filipino women from accessing timely diagnosis and treatment. The implementation of the UHC law and NICA present opportunities for reducing these burdens. However, public spending on health remains below international standards. This panel discussion will explore alternative funding mechanisms to supplement national health spending for cervical cancer programs within the Philippine UHC framework. So to open our panel on health financing, I would like to invite on stage Mr. Renato Limsiaco Jr., Senior Vice President for the Fund Management Sector of the Philippine Health Insurance Corporation. Let's hear SVP Limsiaco's opening statement.
Thank you so much and magandang hapon. Good afternoon, everyone. And thank you so much for inviting us, partners in health. Kasama natin nandiyan si Mr. Palangka, Mr. I have my presentation. Actually, this is a few slides that I will be sharing with you. In fact, this would be interesting to all of us this afternoon. Next slide, please. This is the mandate of the corporation. We will not discuss this one because this is very lengthy. Next slide, please. Click na tayo doon sa importante. This is the statistics of the health care financing and PhilHealth 13.6%. Very small. Of course, our board member here joining us this afternoon, sir. Ganang hapon. Next slide. This is the target for the OPP. 28% in the year 2028. But PhilHealth needs to attain the 27% in that year as well. Right now, we are on the 13.6 and target for year 2024 is 19%. That's high, but we need to reach that one as well. Next slide. This is the finances of PhilHealth right now. We have nearly 500 billion pesos, but we need to make use of this money to proper benefit expenses. And the question is, cervical cancer part of this one? Let's see. Next slide. This is the trend. Instead of increasing, decreasing. And our investment money is increasing, but the contribution to the total CHC is decreasing. We need to reverse the trend to become impactful to Filipino by expanding and improving the benefit packages. That's number one. Number two, we need to implement properly the Consulta program. Tingnan natin what's the content of these two items there. Next slide. Next slide. Next slide, please. The priority is Consulta benefit expansion. I think this is very interesting for the team this afternoon. Next slide. Consulta, everyone should be registered, but only few as of this moment registered to the program. Next slide. Next slide. We are now on 1.7 capitation for Consulta. 1,700 from 500 pesos to or 750 in the part of the private sector. So we increase that one to 1.7 to include the mammogram and the ultrasound. Okay, next slide. of course, mammogram ultrasound to counter the breast cancer. Here, part of the Consulta program is the pap smear, the VIA as well. So included in the program right now. So we need to register in the program so that we can also campaign for each and every Filipina will be get this avail of these benefits as included in the program. Next slide. That's 45% of the expenditures. Next slide. This is the expansion of the benefit that we are saying a while ago. Next slide. So we have the rationalization of the cases and we have the adjustment. This year, 2024, we started to increase the benefit packages at 30%. So for the month of April and May, we feel already the increase in benefit payout. From 47 last year, as of April, this year is already 52 billion pesos. So 10 billion more, nearly 10 billion increase in benefit payout. Next slide. Next slide. Next. Next. But the thing is, where's the cervical cancer? Next slide. Next slide. This is the existing current cervical CA related benefit packages. We have the Consulta kanina. We show that pap smear is part of the program. And we have the case-based package as well, of which 30% in case rate also effective in these benefit packages. And on the Z benefit packages, we have 120, 175 right now on the part of the cervical cancer. The question is this being improved by PhilHealth? Next slide, please. Development packages, prioritization, development of benefit, prioritization. I think this is one thing that we can share this afternoon with you guys. Next slide. The process, a long process, but of course we need to handle this thing so that we can have that benefit packages out for the Filipinos. Next slide. Now, expansion of benefit for year 2023-2025, and cervical cancer is one of the listed as part of the enhancement of selected Z benefit packages. So, nandiyan na po yung cervical. Okay? So, naka-green po. Aside, we have already breast cancer from 100,000 to 1.4 million pesos. Effective na po siya. Next slide. This is the timetable. For cervical cancer, Z benefit, kasama ang kidney, prostate, open heart, the target is that year 2024, the preparation and contracting the year 2025. We need to have the facilities. As of this moment, we have 10 facilities for the cervical cancer. We need to have more. And we need to, please help us campaign for more facilities to join in this program so that many Filipina can avail of the program funded by PhilHealth. So expecting that the Z benefit will increase in the next few months once the packages will be completed and approved, eventually published, and we can implement by year 2025. Thank you so much and good afternoon, everyone.
Thank you very much, Mr. Limshako. All right. So we were supposed to be joined as again by Yusek Pagao, but unfortunately he is leading another meeting with the NICA Council right now. So he sends his regrets for not being able to join us for this panel. Our next speaker is from the Health Technology Assessment Council. We have Dr. Maria Julieta Hermar, a member of the HTAC Subcommittee on Medical and Surgical Procedures. She is also a professor of the College of Medicine at the University of the Philippines, Manila, and the past president of the Society of Gynecologic Oncologists of the Philippines and the Philippine Society for Cervical Pathology and Colposcopy. Please welcome Dr. Hermar.
Thank you. Thank you. So full disclosure, I just want to say that before I was appointed to the HTA, of course, I was on the other side advocating also. So it's also good, but now that's why I want to show you the process. No? So earlier we were told na make it fast, okay? But I just really want to show the process because before being on this side, I didn't know, like, inisip ko, tagal naman, bakit ganun kahirap? So now, let's just go through the process. No? So the Health Technology Assessment Council, we have to systematically evaluate everything that before it's approved, no, by the Department of Health, it has to go through this process, no, whether it's vaccines, drugs, medical procedures, or the HPV test, no. So it has to go through that, and it evaluates the clinical, economic, social, organization, and ethical impact of this health technology to the country. So this one is just to show that the institutionalization of the HTA as a priority setting mechanism, because especially during the pandemic, we realized that there are things that we need to prioritize, so that there's a process that we should follow. So this is the general HTA process. No? So there's also this expedited process, but like during the COVID pandemic, but this is the general process that it goes through. So for example, we call for a topic nomination, and then society, whether it's DOH or the local sector, would nominate the topic, and then we prioritize a topic, and then we do a scoping and protocol development, and then the topic is assessed, and then the evidence is appraised, and then it's only then after the evidence is appraised by the externally commissioned group will it go through the HTA Council for a preliminary recommendation, and then it goes to a 2-week stakeholder consultation. So that's a time when local societies, all stakeholders are invited so they can speak, no, for this topic. And then after that, there's a final HTA Council recommendation and the decision by the Secretary of Health. And then after that, the information that once approved is disseminated already. So it is a really long process, but sorry. So the topic prioritization, like for this quarter, we finished in the second week of April, but it's a long process, 4 months, and there was that 1 week that we were kinulong kami sa Binangon, just so we can go through all the topics and then we prioritize. So, and the end goal is which topics are prioritized to proceed to HTA. So there's a very tedious process. I won't show you that, but it goes through a very long process per topic, no? So, and there are scoring systems that we follow, and the stakeholders are there are even patient advocates represented in the council. And then, so we've published this. This is already published. And if you look at the red box, that's already the HPV vaccine. So it's already part of the topic prioritization. And I have to say, although I didn't, of course, vote in that, because of course there's conflict of interest. So even if I'm in the council, I'm not part of the voting process for things that I have interest in. So for the HPV vaccine, I have to say though that it was one of the highest in the topic prioritization. Okay, so it was recognized. Evidence is very good, and the need was recognized. After the topic assessment, the end goal is it goes through the formal scientific methods of evidence synthesis. So there's an externally commissioned group. Then we go through the evidence, and then the end goal is an HTA report, which will provide the evidence for the development of the recommendation of the council. So, and then the HTAC evaluates and makes a judgment, and then recommends now, right? And then, as I've said earlier, they will gather stakeholder inputs. This is where it's very important that societies or other entities would support research on cost effectiveness, on utilization, so that this will be the final deliberation for this topic to be recommended already. And then, so after the stakeholder inputs, it becomes a final HDAC recommendation, and then it goes to the Secretary of Health. And then after that, so just an important note, per the UHC law, the Secretary of Health cannot approve a health technology for funding without a positive HDAC recommendation. So it can't be bypassed. So that's why it's a very important part of the process in UHC. Okay, and then finally, we have published materials to communicate the coverage decision. Okay, so there. So now the HTA is under the DOST, and you can look at the recommendations or even the advisories in this website. So thank you and good afternoon.
All right, our final panelist is Undersecretary Wilford Will Wong.
Functional Group Head for the Local Government and Regional Operations Group, as well as the Organization and Systems Improvement Group of the Department of Budget and Management. Let us all welcome Yusek Wong.
Thank you, Joyce. Yes, just to quickly give my statement, on behalf of the DBM and Secretary Nina Pangandaman, who's one of the female leaders of the cabinet, we fully support this advocacy and project of your group, and we'd like to thank the organizers for having us today and making the DBM part of this conversation. We initially have already funded from 2023 500 million to the Cancer Assistance Fund, and now for 2024 it has already increased to 1.2 billion, if I'm not mistaken. So be happy to continue this conversation and discuss this over the panel, and wish everyone that while we're having our snacks, a productive conference. Thank you very much.
All right, so we will now proceed to our panel discussion. So may we invite back on stage the rest of our panel. Mr. Renato Limsiaco, sir. Dr. Maria Julieta Hermar, and again, Yusek Wong, please. And to moderate the discussion, we have with us today Dr. Madeline De Rosas Valera, currently a Senior Technical Advisor for Vital Strategies. In the past, she served as an Undersecretary of the Department of Health and Senior Vice President of PhilHealth. Let us all welcome Dr. Madeline De Rosas Valera.
Thank you so much. Good afternoon. Dito na lang ho ako. I just say because I have my script on my laptop. Afternoon, everyone. Enjoying your snacks? I'm sure you'll enjoy this moment because we'll be talking about money and financing. We all know that there's a saying that money is a terrible master but an excellent servant. And there's also a saying that do not focus on money, instead focus on the problem that needs to be solved for the world. So for this portion, although we'll be talking the financing, we will be also talking about the problem that will lead to solve and have a better financing for our cervical CA. And we all know that the cervical CA, the high out-of-pocket expenses and financial constraints prevents Filipino women from accessing timely diagnosis and treatment. And so the implementation of the Universal Healthcare Law and the NICA present opportunities for us for reducing these burdens. However, public spending on health remains still very below international standards. There was a study made earlier, last year, and it identified several core financing challenges and opportunities for accelerating cervical CA elimination. That's under the Think Well sponsored or commissioned by the Union for International Cancer Control. And in that study, they identified sources of funds to finance cervical cancer and other health services. One is on the general revenue or taxations. We have taxes, also revenue also from the sin tax, revenues from casinos and lottery. So you can start you're going to the lottery, buy more tickets, so we'll have more money for our cancer care. We also have the sin taxes, and I was involved then during that time as a USEC with Secretary Ted, who was also USEC, fighting for the sin tax. There's also the individual employer contribution, the premium contribution from PhilHealth, the private health insurances, and of course, the out-of-pocket that remains to be still very, very high. And I think it's even still more than 40% or even 60% out of pocket, especially for catastrophic illnesses like PhilHealth. So, are you ready? Mr. Limsiaco, SVP Limsiaco, good friend Lynette, already told you about the plans of PhilHealth. A year ago, almost a year ago, June 2023, there was a commitment by then the president of, still the president of PhilHealth, Mr. Ledesma, to improve the benefits for cervical CA. And you can already see that in his presentation, there is a plan. May I know, in making your benefits for PhilHealth, I'm not anymore reading these questions as given to me, because he made the presentation. If he did not, I will read the questions. So this will make it a lot harder for you, Mr. Lucia. You already mentioned the 175 increase?
Existing.
The existing, okay. In that 175 existing, how much percentage is that the supportive value of PhilHealth in the overall cost of cervical cancer care? Would you know? Yes, ma'am.
I'm also in the, when we developed the Z package for cervical cancer.
Yes, ma'am.
And then, actually, tama naman si sir, we niuna lang nila yung breast. But last year, we were working on it. And then we already, kasi we have to update the staging. It's already different.
Yes.
We have to update the treatment.
Yes.
And the diagnostics now, since imaging is part of the staging, we need an update. So we've already met with the PhilHealth several times last year. And then, kaya lang po, yung costing, nandun na po kami sa costing. Inuna po na muna nila yung breast. That's why now that I saw that from 100,000, it's now 1.4 million. So I'm so very hopeful, sir. As Marla said kanina, she's in the other room kasi. We are already going to increase. So dun sa 175, that covers whether 120 is 120,000. That was like 10 years ago when we did this. 120 covers surgery, or if they use low dose brachytherapy. 175 should cover from everything from the diagnostics to treatment. So it should have covered then at the time a high dose rate brachytherapy. So the entire treatment package, but this is not enough anymore now, ma'am.
Yes.
Yes, ma'am.
Yes, sir.
Ma'am, thank you so much for that information. Hindi ko alam yan. Looking into the increase in ZBN for breast cancer, this is 14,000%. 100,000 to 1.4 million pesos. And we are looking as well in that kind of increases in the adjustment, not only for the breast, the cervical cancer, but to the other Z benefit packages as well. So hopefully that the study on the costing will be completed right away in this year, within the year, so that all the requirement board member will be completed and will be presented to the board. And Yusik Wong sit as one of the board member of PhilHealth representing the Department of Budget and Management. So this is the commitment of President Mandy Ledesma and Secretary Ted to improve the benefit packages of PhilHealth. And we started already last year and continuously doing this year and the next year as well. Thank you so much.
Thank you. Thank you very much. The breast cancer benefit was increased. I believe I did a study on the costing, and that was submitted to PhilHealth. It took me 1.5 years. Unfortunately, there's no one from the Department of Health. I would want to take that advantage. Why it took me 1.5 years? Because I couldn't get the costing from the hospitals, from the government hospitals. And I hope this time the government hospital will be able to provide the costs for the cervical CA. It will not take any more 1.5 years to do that.
And I believe also that one of the important component here is that sharing of information. Where we get that information is very important. And if that information is not available to PhilHealth, to the costing team, definitely the package rate will be lower, as we will be basing as well in the market and the existing usage of that services in the hospitals. So we need the costing from the hospital as well.
We have the right information, then we can do a right costing analysis, and PhilHealth can now provide a better benefit for everyone.
Yes po.
That's very good. But how
Thank
much
you.
is the target of PhilHealth support when it comes to support value
Mm.
to hit the universal health care?
Based on the presentation a while ago on the national health financing strategy, 27% by year 2028.
27%
27%.
increase.
No, 27%. Right now we are 13.6% 2022. Contribution to the total current health expenditures. So that's the target of the national government.
So that's still way below the out of pocket, sir.
The out of pocket is 44% year
Precisely.
20, and of course moving towards that direction, and if the resources is available in the packages is available, improvement, because it's not easy to come up with a package actually. Even that cervical the breast cancer, you mentioned a while ago that you took more than a year to complete the costing, and the same thing as well, not only for the cervical and the other packages that we are doing right now. So hopefully we can fast track the costing and the preparation so that we can effect whatever adjustment in the case rate. As again, this is the trust of the national government, PBBM, PC, Olidesma, and Secretary, and the board members to improve the packages of PhilHealth, as this is 13 years already that it was not touched by the corporation. So we need to make that things happen, increase that one, as we have the resources right now available.
And not return money back
you.
to the Department of Finance, right?
Yeah, the DBM here.
Okay, DBM is here. That's why I'm going to DBM at the moment, sir. Yusek. With that plan in mind, the next few years, how would DBM now support the need for increasing the benefits for cervical cancer?
For on DBM side, we rely on the submissions of the primary agency concerned. For this instance, in this case, it's the DOH. So that is part, we ask them for their budget priorities framework, and it's also dependent on the Philippine Development Plan. And of course, health is also one of the major aspects that the PDP is focused on, like increasing of accelerating the implementation of the Universal Health Law, providing healthcare facilities to different extent and services as well, improving capacity building on the human resource. So it's more of a 360-degree approach that we are so in support of this program. And that is where, from the budget priorities framework that is given to us by the concerned agency, that we will be able to allocate or more or less resources on a certain program.
DBM will always rely on the submission of the national government and the local government.
More on the, since we're on the national level.
More of the national
Yes,
level.
the data and the
I remember when I was in USEC, I would always be, especially during the budget preparation, I will always be at DBM at night, knocking on the door. Where's my budget? Are you increasing? Do not remove that budget because we need that badly. So in that case, as USEC,
that episode, ma'am, is happening now. It's budget preparation.
yes,
season.
I remember
So-
that. I would be bringing my boxes of Jollibees, and according to the security guard, that is not allowed. No, but I am eating with them. Don't you worry. Here's your Jollibee. So I just run up and stay with the DBM people working on the budget. Okay, I think you have to do that often, Lynette, together with the DOH. Yeah. So there's also the Mandanas funds that is going to be downloaded to everyone. Mandanas is Governor Mandanas, and he won Supreme Court, wherein they would be providing more funds to the local government. So any information you can just share with
for
us
the
on that?
Mandanas Garcia ruling, yes, actually this is in relation to the NDA. Before they call it IRA, the
Yes,
Internal
the IRA.
Revenue Allocation or Allotment. Now, since after the Supreme Court has ruled on the Mandanas Garcia case, It's now called the NTA, or the National Tax Allocation, wherein the LGUs gets a bigger share of taxes nationally, of those nationally collected. So since 2022 po, the taxes or the NTAs of the LGUs has increased na po. It's an upward trend because it's computed, the taxes share of an LGU is computed the 3 years prior collection. So since 3 years ago, it was pandemic, so collections were really down to 3 years ago. So now po, by 2024 is an increase already compared to 2023, lalo na po in 2025. The NTAs of the LGUs increased, and that is where the LGUs can budget more resources for health services. So it will now all depend on the LGU's priorities kung saan po nila ilalagay.
Thank you, Yusek. So we know that there will be fund available for the LGU to work on health, but the Mandanas Fund does not only cover health, so it covers everything. So still, the budget will still be very limited for our cancer care. Dr. Hermar, I know, as I've worked with HTA before, given the need to roll out an organized population-based national screening program so we can increase the screening uptakes, will the HTA also assess cost effectiveness of adopting digital tools for program tracking and other updates on what else can HTA do to fast track or
So usually, ma'am, so when the HTA looks at digital technologies, it's also only if there's a health implication or there's a health impact. But if it's for tracking, it doesn't have to go through HTA. So pwede na yung for digital tools for tracking, it doesn't have to go through HTA. That's, ma'am, I just want to mention also that I forgot to say that the HPV vaccine is already prioritized. Actually, the HPV test was nominated by DOH in 2022, and then it was approved for, it was prioritized November 2022. But the commission group was only, parang, wala pa ako na, ma'am. Pero August 2023, yung externally commissioned group. And then they're already undergoing the process. But remember, when they get an externally commissioned group, it's not only HPV testing that they're doing. They're also doing other technologies kasi nga because of the budget concerns. So ang target is that it will come to the HTA Council by end of this year. So hopefully by end of this year, it goes through the council, and then there's a stakeholders meeting, and then finally, sana malabas siya by the end of the year or sana by January 2025. There's already recommendation to the Secretary of Health, which after that, I guess, babalik ulit kay Yusek Wong for budget.
In that case, how can the private sector, pharmaceutical industry, and other private sector fast track the HTA and help HTA? In the UK and other countries, they ask the pharmaceuticals to do the cost effectiveness analysis, and they would already just review the methodology.
Yes. Actually, ma'am, now we have been sitting in with the UK Council, with our counterparts in UK by Zoom, so that we know also their process. So we are doing that as well. So as I mentioned, after the externally commissioned group submits the evidence to HTAC or the council, then we call for a stakeholders meeting, and then that's when the stakeholders can present studies that will support it. That's why even now, if there are studies that they can show or they can commission cost effectiveness studies before it's released or before the stakeholders meeting is called in the last quarter of the year, then it would be very helpful. So that's one way to fast track, so that mas mabilis po yung final recommendation to the Secretary of Health.
I remember before, the Secretary of Health can provide a temporary approval, but you mentioned that you cannot anymore.
Not anymore, ma'am. So now it's only when there's a positive recommendation from the HDAC that the Secretary of Health can approve vaccines, drugs, or medical procedures. So it's a check and balance.
It's hard to do a cost effectiveness analysis if you are not, if you're introducing a new technology. And my experience is that it would also be an advantage if we have a transferability of information from other countries.
Yes.
Is that now being accepted by
Yes,
the
yes.
HTA?
Actually, in the topic prioritization, if it's not available in our country, then we use the data that we get from other countries. If meron Asia, better para similar to ours. But otherwise, they're open naman.
That's good to know. So at least it
Evolve
is...
na ma'am yung HTA. Nag-evolve na po.
Nag-evolve na. Okay. I thought, I said, I was even telling some of my staff before, I gave birth to HTA. Can I also kill it?
Wag naman, ma'am. Wag. So, ma'am, it's very,
I'm going to kill
iba
HTA.
na.
Don't you worry. It's growing. It's
Yes.
going to be on its how many years?
Yes.
We started HTA in year 2000 in PhilHealth. And now it's 2025. 25
So, very
years.
na ma'am, nag-iba na po from before.
25 years old. Ay. Binet, hindi ko pa nakatakas sa akin. The key objective of the Universal Healthcare Law is to ensure that financing promotes service integration, the whole of society approach, opening new opportunities for integrated services delivery across the, already mentioned, the cervical cancer service continuum. What is there a possibility for which PhilHealth has already been discussed and mentioned, the success of integrating, and even the DOH, Jan, telling that there's a need for integration with other illnesses? Is there a possibility for which PhilHealth can come up with a benefit that can integrate several illnesses and services under your consulta?
Okay. Two things. One, Section 19 of the law states about integration. This integration towards the local government unit. Integration, managerial, technical, and financial.
A technical side.
So, on the part of technical integration, the primary care, the hospital care, level 1, level 2, APICS, that's the integration of on the part of the technical. On the side of the financial, we have the special health fund right now. In that special health fund, of course, hindi man sa pangmamayabang, galing ako sa local government unit. I am the one proposing that one during the time that we are developing the UHC law. So, na-adapt siya. And we are testing right now in terms of how that special health fund will be an integration tool financial on the part of the LGU. We have Bataan, we have Southcote, we have Baguio, and we have Quezon City implementing the special health fund right now. Wherein the money coming from PhilHealth for the primary care consulta, integration of the local health system, rural health units, doon namin binabagsak. So they started already and expecting that by this month or early next month, we can release the second tranche of money based on their performance for the first release that we had in the year 2023. So that's one thing. On the second thing is that integration COPB. I just came from a meeting in office, but we are discussing the benefit plan for year 2025-2026, and COPB is one of the important things that we need to implement, because this comprehensive primary care benefit, this comprehensive is provided by law, mandated by law, that PhilHealth, of course the health system, gonna set up this thing. COBP na siya. Of course, the consulta will be form part of that one. Emergency care will form part of that one. And similar other outpatient benefits as well to be form part of that COPB that PhilHealth will gonna fund. So,
siempre pa'lante con toda mi gente. Ni un paso más para atrás, ni un paso más para atrás, ni un paso más para atrás.